Hey guys, this is Dr. Hub. Today we'll look at the pulseless supracondylar fracture and its management. So firstly, we look at the displaced supracondylar fracture with absent pulse. Then we move on to check if there is adequate perfusion. So assuming it is adequate perfusion. So adequate perfusion, it results in the reduced fracture and the pin. So there is by reduce the fracture and the pin. Next would be to observe if the capillary refill time, temperature and the color indicate adequate perfusion. So then you observe the capillary refill time, so CRT, and then also the temperature, then the color. So all this should indicate adequate perfusion, So you observe all this. So the next stage will be, in terms of adequate perfusion, the next stage in this will be the admission for the vascular observation. So your admission for the vascular observation, and this is with the elbow in a relaxed position. This is with elbow in relaxed. It is in relaxed position. Next is, it is approximately 45-degree flexion. It is an approximately 45-degree flexion, and they do not use hyperflexed positions. So they don't use hyperflexed position. Then we move on to the other side, that is the inadequate perfusion. So in terms of the inadequate perfusion, there is to reduce the fracture and the pin. First is to reduce the fracture and the pin, and in terms it is a pink and pulseless. So in terms it is pink as well as pulseless. So then you bypass and move on to the what we have already seen, that is admission to the vascular observation. For the vascular observation, and this is with the elbow. This will be with nothing but the elbow, and also if in case it is a relaxed position in elbow, and also if it is in the relaxed position. So in terms of the relaxed position, it will, that is approximately say 45 degrees flexion. So here you do not use the hyperflexed position. So here you don't use the hyperflexed position. Now as we move to the where the reduced fracture in the pin, under that we saw the pink and pulseless of hand. Now on the other hand, there is a remains dysvascular. So in terms of it remains dysvascular. So under this, what we do is explore and repair the artery. So there is explore and repair. The explore and the repair via repair the artery, and this will be via the anterior approach. So we monitor for the compartment syndrome. So we monitor, and this is for the compartment syndrome. So you monitor for the compartment syndrome, and you consider for the fasciotomy. To learn and grow daily like this, please do subscribe.